Welcome back. Today we're diving into something that can make or break safe care, knowing when to call your nurse. Whether you're brand new to caregiving or you've been delegated for years, it's critical to recognize the red flags that mean you need to pick up the phone and contact your nurse delegator now. Let's talk about the situations you should never ignore. In Washington state, caregivers are only allowed to perform nursing tasks that a registered nurse has delegated, trained, and signed off on, according to the WAC. According to the DSHS Caregiver Training Course Workbook, caregivers are legally required to report any change in a client's condition to the nurse immediately. The nurse can't keep the client safe if they don't know what's happening. Concern number one is a change in condition. This is the number one reason to call the nurse. It includes things like new confusion, agitation, behavior changes, a fever, a new cough, pain, swelling, unusual sleepiness or weakness, or any fall or injury, even if the person seems okay. When in doubt, report it. Don't wait to see if it gets better. The nurse needs to know so we can reassess, notify the provider, and update the care plan if needed. Concern number two is anything unusual with their medications. If there's a missing dose, an unreadable MAR entry, a med dropped or refused, or the label doesn't match the MAR, or if you're just unsure whether to give it due to a vital sign or a symptom, you must call your nurse. Under the WAC, caregivers are required to follow instructions exactly and notify the nurse if a dose is skipped, delayed, or given differently than how they were trained. Concern number three is the refusal of care. Some caregivers assume that if a client refuses care, there's nothing more to do. But that's not actually the case. With delegated tasks, refusal, especially of medications, must be documented and reported. Refusal could be a sign of side effects, mental status changes, or a deeper medical issue. If a client refuses medications, wound care, or vital signs, don't skip it quietly, call the nurse and chart the refusal. This is a vital part of protecting their health and your legal responsibility. Concern number four is out-of-range vital signs. Vital signs like blood pressure, pulse, temperature, or blood sugar are often delegated to caregivers, especially for clients with diabetes or heart conditions. If you get a reading that's outside the parameters set by the nurse or the doctor, you must hold the medication if instructed, report the reading to the nurse immediately, and document what you did and when. Concern number five is anything that feels unsafe or unclear. If something doesn't look right, feels wrong, or isn't how you were trained, that's your cue to call the nurse. This could be a new task that you haven't been delegated, a wound that looks worse all of a sudden, a medication you've never seen before, or pressure from someone to just do it anyways. If it's not in writing and the nurse hasn't trained you, you can't legally do it. If it's not in writing and the nurse hasn't trained you, you can't legally do it. I don't speak for every nurse delegator, but personally, I prefer more communication over less. If you're ever unsure, I'd rather you reach out. That being said, if I notice a pattern of frequent non-urgent calls, I will help set clearer boundaries and provide more training to build your confidence. The goal isn't to overwhelm either of us, it's actually to just create a safe, supportive system that works for everyone.